What's up, YouTubers? Quick observation. I'm in E-Cafe, as you could probably tell. I just ordered a coffee. This is a quick observation. Their marketing kind of sucks because they have a plastic window in front of their tip jar. So you can't really leave a tip anymore unless you ask and pass it around. That's kind of interesting. But the other thing is, the coffee is at 15Q, and they charge you an extra Q for something. The only reason I bring that up, it's only like 10 or 12 cents, but it's funny because if you shop at the bakeries here, Chez Le Pan, they charge this extra fee now, like I think it's 1Q or 1.5Q or I don't know, it's like a Q or something. I don't know if that's a special tax they just put in, and I don't know if it's related to coronavirus. It's just interesting because I just noticed that before, like if the menu said 15Q, it would be 15Q, but now all over when I shop now, there's like whatever the price is plus 1 or 2Q. So maybe they're just adding up the tax separately like they do in the US, which they never used to do before. But the one exception is in the mall, and they didn't do that. So I don't know if that's a special tax on food or coffee or something related to coronavirus. If you've seen that and you're in Guatemala and you know what that's about, leave a comment. Thank you. Meanwhile, I'm going to enjoy my coffee and check my email, see if I got any hate mail. What's up, YouTubers? It's me, Johnny, again. I'm out here by the Pila, back in my little backyard. Had a pretty good day today. Took my clothes to the laundry. I thought it was like not 4 o'clock, but I must have got back late because the girls are already closed. Normally in Latin America, things don't close on time or open on time. But where I live, apparently, she leaves at 4 o'clock sharp. I didn't realize that. I'll have to pick up my stuff tomorrow. Anyhow, had a pretty good day here. Not much going on here. I've been doing more research on traveling. Just to take the Tika bus is going to be a pain in the neck. Like you got to go online and fill out some forms and papers and have the COVID test. That's not really hard or nothing, but it's just a pain in the neck. I was just looking too. If I want to go to Nicaragua, it's like $500 or $600. If I want to take the bus, it's like 150 round trip from the capital. And some of the trips, like if you go to Nicaragua and you want to pay like $300, you got to fly to the United States, fly back to Nicaragua. It's like retarded. That's the world we live in now. And if you fly to the United States, you got to wait there 12 hours and fly back from Guatemala. I mean, to get to Nicaragua. Anyways, just going to the adjacent countries, not like it used to be. It's not easy. Unless you travel like locals and just cross the border, which that's always an option. As JC likes to say, always an option. There's always an option. Anyhow, I was going to make some comments on healthcare. Like I was listening to some of the recent podcasts of Johnny Mueller. Like people worrying about getting their healthcare because they don't speak English. That's people like me. I've had great healthcare. Just as a heads up. The first time I came, well, not the first time, but one time I was in Shayla and I had incident at the mall where I hit my head on this glass thing and it started spurting out blood. Now at the time I didn't realize it was spurting out blood. Anyways, it's pretty alarming. And I made a video about this before, but there's a lady doctor there who didn't speak any English, and what she did was she used her phone app to translate from Spanish into English about helping me go to the hospital. Anyways, what we ended up doing is we ended up going to the IGSS hospital, which is a free one, which incidentally, that's my gringo advantage. I got to go in there. She said she worked there. She talked to the guard and we cut the line, which at the time didn't make me feel good, but I went in there. Anyways, my experience was here's a young guy. He was a doctor. He stitched me all up. I had to wait like 20 minutes. He stitched me all up and we were talking in English about various odds and ends, but it's pretty uneventful. And then I went to the private hospital, not the clinic, I think the private hospital, one of the lower cost ones, and it was, I think, 150 or maybe 200 to get the stitches out. It didn't really cost that much. So if you want to self-insure, that's one option, but that was one of my experiences. And then I had another experience here in Shayla, as a matter of fact, where I had an issue too, and unbeknownst to me, the people here, because my Spanish sucks. Hold on a second. Got to check on my vegetables. I have steamed vegetables cooking right now. Anyhow, I was in one of the local banks here, and it's funny, they got kind of excited because I had a little issue there. Anyways, they had called the Red Cross, and they sent out kind of a Red Cross ambulance kind of thing, like a van ambulance. They checked my pulse and stuff like that. Anyways, they ended up driving me to one of the not a hospital, but more like a clinic maybe. Anyways, it was all free. It didn't cost me anything, but they checked me out and they took me to the hospital, and I got I think it was not my blood pressure, but I think my blood pressure taken, and everything was fine. I just went home from there, but that was free. That was the Red Cross kind of, I don't want to call it an ambulance, but something like an ambulance. Anyways, that was actually free. So they do have other paid services you can buy down here that are super affordable that you can do. Alerta is what I'm thinking of right now. Medica or Alerta. They have, I think, a policy for $300, where if you have an elderly person in your home or you need that kind of a service, it's available. Anyhow, I just was thinking about my medical experiences here, and I too was kind of scared not being able to speak the language, and that's a scary thing to think of. If you're vulnerable, something happens to you, like happened to me. I was just clumsy. I ran into a kind of like a glass wall, but not a glass wall. Anyways, I got my stitches, and it's pretty uneventful. But anyways, at that place, they spoke English. Then I went to a kind of a more affluent hospital here in town. I just had a cold. I just wanted to go and see what the experience would be like. And it was pretty neat. It was pretty sterile. It was a brand new hospital, I think. And the doctor spoke, and he's an older guy in this case, and wrote me a prescription for, I don't know what, antibiotics or something. Anyways, it was kind of expensive, like 300 Q, but that was kind of the expensive hospital. Anyways, that's just been my experience of getting healthcare. It's actually pretty affordable, and if you want, you can get insurance. It's easier if you have a residency, but they have cheap, affordable insurance policies if you get kind of the 80-20 ones where they pay 80% and you pay 20 out of pocket, kind of like what do they call them? HMOs, yeah, HMOs, sort of like that. Or you can, if you're a younger person, you can just self-insure and kind of do like what I do. But in any case, if you go to the more expensive hospitals and clinics, usually someone almost always will speak English in those places, so you don't have to worry. And now with all the different phone apps and stuff, you can communicate that way. But I just try to use my Spanish. That's what I do. So far, it's worked out pretty good. Anyways, it just didn't have nothing to talk about today too much, except for whining about my laundry. I wish I'd went there earlier. Anyhow, this is Johnny. I'm going to put this up, see what comments you have. Pretty uneventful day. The only thing that pisses me off is now, eventually I'll have to go back to say, well, I don't really have to, but I got to get a COVID test. This thing is starting to get totally ridiculous. Totally ridiculous. Anyways, like, share, subscribe, and leave a comment. Thank you.